September is Blood Cancer Awareness Month. The one we're talking about this morning, multiple myeloma, a life-threatening, incurable blood cancer that affects thousands of people in the U.S. Fortunately, when it comes to combating it, few types of cancer research have experienced as much progress as multiple myeloma in the past decade. Here to tell us more, Dr. Saad Usmani of Levine Cancer Institute. Good morning, doctor.
Thank you for having me, Kelly.
So first off, what is multiple myeloma and how is multiple myeloma typically treated?
Multiple myeloma is the second most common blood cancer that occurs in the United States. I think as you introduce the topic, you're right, it is an incurable cancer. It generally occurs in folks who are in their late 60s or early 70s. Before they're diagnosed, patients generally don't have a lot of symptoms until the disease is advanced. But we have come a long way in the last decade in how we are treating the disease. There are several different treatment options available to us today that weren't there before. When I was a medical student, we only had a few chemotherapy options, and the survival outcomes were not that great, not more than 2 or 3 years at best. But things have come a long way in the last decade or so.
So, doctor, how have your expectations changed, if at all, for multiple myeloma patients in the last couple of years, especially at relapse? And what do you tell your patients?
Previous to these advances in the last 2 or 3 years, where we've had newer treatments that have been approved as well as newer indications for multiple myeloma, we only had 1 or 2 treatment options for myeloma patients. Now it's a series of successes and failures. We get patients into a remission. We try to pick the best treatment options for them that keep them in a long remission. But 4 out of 10 patients will fall out of remission. And that's where the relapsed patient management becomes important. You have to pick the right options. More recently, proteasome inhibitors such as Kyprolis have shown very promising results in randomized phase 3 studies, where we're actually seeing survival benefit of Kyprolis and dexamethasone compared to standard of care with Velcade and dexamethasone. Overall survival benefit is very important for this incurable disease. What we mean to do is to improve how long patients live. So with Kyprolis and dexamethasone, the overall survival was found to be 47.6 months compared to 40 months in the standard of care treatment arm. So these results are very important. They help us pick and choose the right treatments for patients. We, of course, have to also keep in mind the side effect profile of each of these treatments. Kyprolis can cause some heart problems in some patients, so the treatment really needs to be individualized for these relapsed myeloma patients.
And doctor, we are running out of time, but where can our patients go for more information on what we discussed today?
So patients can go to Myeloma Foundation websites such as the mmrf.org or myeloma.org for disease-specific information. They can visit Levine Cancer Institute's website to find out what me and my team is doing. For more drug-specific information, for each of the drugs, there are websites available. So such as for Kyprolis, you can go to kyprolis.com and find out more information from your doctors.
Well, thank you so much for your time this morning, doctor.
Thank you, Kelly.